71 times before, our National Health Service has marked the anniversary of its founding, but never in circumstances quite like this. Because this year, we've seen not only the greatest challenge the NHS has ever faced, but also an unprecedented outpouring of affection and support for that institution. Week after week, millions, tens of millions of people have taken to their doorsteps, lined the streets, leant precariously out of rainbow-bedecked windows to clap their hands, bang their saucepans, and show their appreciation for the NHS. And that's because those three letters don't just stand for National Health Service, they stand for an idea, for a set of values at the heart of our national identity, for the belief still held almost universally after nearly three-quarters of a century that the health service of this country should be available to all, that everyone should contribute to the cost, and that no one should be denied the treatment or attention they require because they can't afford it. That is what those three letters stand for. And behind them stand the very special men and women who make it all happen. Doctors, nurses, midwives, paramedics, pharmacists, porters, cleaners, radiographers, administrators, and many, many more. Amazing people in an amazing organisation, and one that fills me with pride. As Prime Minister, I'm proud to have given the NHS a £34 billion funding increase, its biggest in decades, and made sure it has every penny it needs to cope with coronavirus. And as a citizen of this country, I'm immensely proud that the infant conceived, gestated and delivered by Beveridge, Bevan, Willink, Godber and so many others has grown into the venerable, sprightly 72-year-old we see today. Happy birthday, NHS, and here's to the next 72.
Ladies and gentlemen, today marks the anniversary of the foundation of the National Health Service. On July the 5th, 1948, just 4 months before I was born, Trafford General Hospital opened its doors, providing care to all according to their need, not their ability to pay. After more than 7 decades, that founding principle, though now familiar, is still a profoundly moving statement of our values, and it has never been more relevant than it is now. The current pandemic means that the NHS and the entire country has been through the most testing time in the service's history. Of course, our whole society has risen to this extraordinary challenge, from the farmers, fruit and vegetable pickers, delivery drivers and shop workers who provided our food, to the energy workers who kept the lights on, the transport staff and the public servants and business people who continue to provide vital services. Every new difficulty has been met with a new solution. Countless volunteers have come forward to help those in greatest need, and of course, all have had their part to play by heeding the official advice to help stop the spread of this cruel virus. This renewal of our community spirit has been a silver lining during this dark time. Our communities have been put to a severe test, and true to our best traditions, they have overcome it with determination and imagination, with good sense and with good humour. During these past months, the phrase "to shield" has taken on an emphasis it did not have before. But while the meaning may be new, the principle of protection for those in need is timeless. In Psalm 18, we read these words of thanks for deliverance from danger. You have also given me the shield of your salvation, and your right hand has held me up, and your gentleness has made me great. To all who have given so much during this present danger, I just want to say that it is you who have been our shield. It is your hands that have held us up. It is your gentleness that has made us great. Despite all that has been endured, there is deep cause for gratitude and a true reason for pride in the way we care for all members of our society. Our greatness truly is in gentleness. So, ladies and gentlemen, thank you all for what you have done, more than I can possibly say.